Hello, I am Ariel Carter, and this is my neuro assessment. Today, my participant is Tony Rush. He will be assisting me in my assessment. So, first, we're going to do our cranial nerves, all 12, and I'm going to start with his olfactory. So, in order to assess his olfactory nerve, I'm going to ask you to let me know if you can smell this lemon juice. I'm going to hold one nostril and squeeze, and you just say yes or no.
Yes. Yeah.
So now we're going to test his cranial nerve, which is the um, second nerve. And this is going to be the visual field test. I'm going to have you cover one eye with his card. And I'm going to cover the same eye with my card. And this is just going to assess his muscles and his vision in all fields. So with this eye, I want to ask you to look directly lateral in your peripheral. I want to actually look up to the side and then downward to the side. Yes. Look at me. Look inward as if you're looking at your nose. Great. Okay. We're going to do the other eye switch card. We're going to do it now. Look to the side, your peripheral. Look up, peripheral. Look down, peripheral. Then I'm going to actually look at my finger right there inside. Great. Then we're going to do nerves 3, 4, and 5, which is your oculomotor, your trochlear, and your optimus. And that is going to measure the 6 fields of acuity as well. So actually, I'm not going to have you stand up. I'm just going to do it. We're going to do the same thing again, but we're not going to use the cards, okay? So usually you'll use a pen light for this too because you'll be assessing the accommodation, the size, and the pupil's reaction to light with this. So usually it's a pen light here, so I'm going to ask you to follow my finger. Go in, and then you look at his pupils as they react to the distance of your finger. Go down, inward. Great. And then I want to do the same with his follow my finger. Nice. Up, over, inward. Great. All right. So now we're going to do nerve 5. Excuse me, that was nerve 3, 4, and 6. And now we're going to do nerve 5, which is your trigeminal nerve, which is the mastication. It's actually just going to assess his mastication muscles, his jaw muscles. So what I'm going to ask you to do is clench down on your teeth really hard. Exactly, yes. And you'll feel the muscles as they get firmer. Do it again. Nice. All right, facial nerve. This is cranial nerve 7. For your facial nerves, a lot of stroke patients, they have a lot of asymmetry. So they use this assessment a lot with stroke patients. But in just your regular assessment, it's just going to ask your patient to smile. And you're looking for symmetry. And you're going to ask them to frown. That's sad. That is okay. And then you're going to ask your patient to frown or be sad. Yeah, exactly. That's frowning. Frowning is really good because it actually gives you a good picture of if it was asymmetry, how our face would probably be droopy, but there's symmetric all the way around. Great. Um, nerve 8, cranial nerve 8 is your acoustic nerve, and this is basically hearing. You want to assess for the patient's hearing. So I'm going to whisper something in your ear really low, and I just want you to repeat it.
Neuro assessment.
Good job. All right. Nerve number 9 is your glossopharyngeal in your vagus nerve. And this one, what it does is it assess your soft palate and it also assess your tongue. So what I'm going to have you do is I'm going to have you lick out your tongue. Ah,
Uh,
yum. All right, and you're looking for symmetry with the tongue as well. Great job. All right, now we're going to assess spinal nerves, and this is just going to assess how well his spine can accommodate to resistance. So what I'm going to do is I'm going to put my hand on the side of his face, and I want you to turn where my hand is at, as if, and I'm going to give you some resistance.
body. My body.
Just your head.
Okay.
Yeah. Great. And do the same with this. I'm going to give you some resistance. Great job. All right. So, cranial nerve number 12 is your hypoglossal nerve, and this is assessing your tongue too. But this one is actually going to assess with speech. So I'm going to have you put your tongue out all the way. Right? And then now I want you to repeat these words. Dynamite. No, you can close your mouth now. I'm sorry. Do dynamite.
Dynamite.
Light. Say light.
Light.
Tight.
Tight.
And this is assessing for like the I's, the T's, and the D's for his tongue. Because some with a lot of speech impairments, they won't really enunciate the D's or the I's or the T's. So that's a great way to assess for that too. So those are my 12 cranial nerves, and now we're going to move on to our reflexes. So I don't have a reflex hammer, so what I'm going to do is use my assessment, the bell part, the diaphragm part of my stethoscope. So I'm going to put this down a little bit so that we can see beneath. Okay, and then the first reflex that we're going to do is the biceps reflex. So what I'm going to do is have you sit straight, like come more towards the end of that. Okay, great. And then I want you to fold your arms so that you're like this, so that you're clutching right here, more on your forearms, your arm, exactly. Hold them up, and then put your knees together here. And then I'm just going to hold here, and this is going to, I'm just going to assess reflection up in your biceps area. When I hit this, you should be at the front. You feel it? All right, great. Okay, so now we're going to do the triceps reflex. I'm going to take one of your arms, turn it here, and just act like this is dead weight. Okay? And then I'm just going to hit this arm and see if there is a flexion here. Great. Then we're going to do his brachioradialis reflex. Going to have here, hold his thumb, relax your muscles. And we're going to look for flexion here. Pulls back. Great job. Now we're going to go to your quadriceps reflex. And then this is almost like the first one. I'm going to hold your ear. And with this, it's usually known as when your knee kicks out. So actually I'm going to do here so you don't kick me. And then I'm just going to hit your right below your patella here and see if your knee kicks out. All right, great. All right, now I'm going to have you lay down. All right, and with this is the Achilles reflex. And what I'm going to have you do is just put one knee up, like bend one knee and leave one knee, like not too much, just slightly. Okay. You know what? Do the other one. Okay, that's good. I have my arm here, and then I'm just going to hit right below the patella to feel flexion. Good. All right. Now we're going to do the Achilles, which is down here, which is going to be the inside. I'm just going to tap the inside of the Achilles. Great. And then we're going to do the clonus test, which is, okay, actually going to come over here. Slightly bend one knee, slightly. And then I'll put this one up. And then I'm just going to dorsiflex your foot. Don't resist. Just be, yeah. Great. And then I'm going to, great. Okay, and then we're going to do our last, which is our plantar reflex. And this is pretty much just rubbing something at the sole of the feet. Can you see the reflex when I do that? Great. And that's it. That completes my neuro assessment. Until next time. Bye.